All right, today we're jumping into one of the most fascinating and honestly mind-bending topics in all of clinical neurology, neglect syndrome. This is a condition that really makes you question what we think we know about perception. Just imagine this. A patient's eyes are working perfectly. The whole visual system is getting the signal, but their brain, it just fails to process one entire half of the world. So, how is that even possible? Let's find out. This quote from a case study just hits it on the head, doesn't it? It perfectly captures how baffling this condition is. For a chess master, someone who lives and breathes in a world of pure visuospatial awareness, to suddenly have half the board just vanish from their mind, it's absolutely devastating. This tells us right away we are not dealing with a simple vision problem. Oh no, it's something much, much deeper. So let's put ourselves in the clinic. Let me introduce you to our patient, Mr. Chen. He's a 68-year-old retired architect, has a history of high blood pressure, and he's just had a stroke. His family is worried. They say he's bumping into things on his left, he only eats the food from the right side of his plate, and his passion, playing chess, is now impossible for him. But here's the kicker, the real puzzle. We do a formal visual field test, and his vision is a perfect 20/20. So that's the big question, right? How can he be functionally blind to his entire left side when we know for a fact his eyes work? This immediately tells us the problem isn't in the hardware of seeing, it's in the software of paying attention. The issue isn't sensation, it's perception. To figure this out and pinpoint where the damage is, we need to do some detective work, right at the bedside. The cool thing about diagnosing neglect is that we can do it with some really simple but incredibly powerful bedside tests. We're talking paper and pencil stuff here. These tasks are specifically designed to poke and prod at the brain's attention networks and really bring this hidden deficit out into the open. So let's walk through them together. Okay, first up is the line cancellation task. It's super straightforward. We give the patient a sheet of paper with a bunch of lines scattered all over it. And the instructions are simple. Please cross out all of the lines on this page. And boom, here's the classic finding. Mr. Chen goes to town on the right side of the page, crossing out every single line. But the left side, it's completely untouched. It's as if for him, the left half of the paper literally doesn't exist. And what's really telling is if you ask him, "Are you done?" He'll look you right in the eye and say, "Yep, all done." This isn't him being difficult. It's a profound breakdown in his spatial awareness. All right, next up is another classic, the clock drawing task. This is a great test for both visuospatial skills and higher level brain function. Again, the instructions are simple. We give him a blank piece of paper and say, draw a clock face and then put in all the numbers. And the result is what we call pathognomonic. It's a dead giveaway for neglect. He might draw a perfect circle, but then he'll cram all 12 numbers, 1, 2, 3, all the way to 12, into the right half of the clock. It's an incredible window into his mind. It shows us that his entire internal map of space is distorted. His mental idea of left has just completely collapsed. Now for our final bedside test. This one is absolutely crucial because it helps us tell the difference between true neglect and a primary vision problem, like a homonymous hemianopia. This test is called confrontation to double simultaneous stimulation, and what we're looking for is a phenomenon called extinction. So here's how it works. We have Mr. Chen stare at our nose. First, I wiggle a finger way out in his left peripheral vision. He sees it, no problem. Then I do the same thing on the right. He sees that too. So far, you'd think his vision is fine. But here comes the key step. I wiggle my fingers in both visual fields at the same time. And what happens? Mr. Chen only reports seeing the finger on the right. The one on the left, it's as if it just vanished. It's been extinguished from his awareness. And that right there, that's visual extinction. It is a hallmark of neglect, and it perfectly shows what's going on under the hood. You see, the damaged part of his brain can handle one stimulus on the left, but when it has to compete for attention with a stimulus on the right, which is processed by the healthy side of his brain, it just loses the battle. The healthy hemisphere's input is so strong, it just completely overrides or extinguishes the signal from the damaged side. So, we've done our bedside detective work. We've seen the line cancellation, the clock drawing, and now we've confirmed visual extinction. Putting all these clues together, we can now make our diagnosis with confidence. Mr. Chen has left hemispatial neglect syndrome. Let's be crystal clear. This is a disorder of attention. It is not a problem of sensation. His brain is getting the sensory information from his left side just fine. The problem is that his brain is failing to assign any importance to it, to allocate the attentional spotlight needed to bring that information into his conscious mind. Now, something you've got to know is that neglect isn't just one thing. What we've been focusing on is visuospatial neglect, but patients can also have motor neglect. This is where they don't use their limbs on one side, not because they're weak, but because they just forget to. You might see their left arm not swinging when they walk. There's also personal neglect, where they ignore one side of their own body, like only shaving the right side of their face. These can all happen together or sometimes on their own. Okay, so we've got the what. We've established the clinical diagnosis. Now for the why. What is actually going on in the brain to cause this profound breakdown of reality? Let's dive into the neuroanatomy. Typically, the story starts with a lesion, usually a stroke, that damages the right side of the brain. Now, while a few spots can cause it, the classic location is the right inferior parietal lobe. This area is a major hub for our brain's attention network. Its job is to help us orient to things happening around us. So when you damage that hub, you basically break the brain's GPS for the left side of space. The result? Left neglect. Now, while that right inferior parietal lobe is the usual suspect, you have to remember that attention is a network function. It's not just one spot. So lesions in other areas, like the frontal lobe, or even deeper structures like the thalamus and basal ganglia, can also cause neglect because they disrupt that same distributed network. It really shows you that our seamless view of the world is teamwork, a product of this complex, interconnected brain system. Okay, this is a super important point, so listen up. You absolutely have to be able to tell the difference between neglect and a homonymous hemianopia. It's a common point of confusion. Think of it this way. Hemianopia is a vision problem. The camera is broken. The patient cannot see. Neglect is an attention problem. The camera works just fine, but the cameraman just isn't pointing it in that direction. The patient can see, but doesn't attend. And that extinction test we did, that's our key tool for telling them apart. All right, we've been through the case, the exam, and the why behind it all. Let's bring it all home and make sure it sticks. We'll do a quick review of the high-yield points and look at a couple more quick cases. Here are your high-yield takeaways, the stuff you absolutely need to remember. Number 1, neglect is a problem with attention. Number 2, it's usually a right brain problem causing left neglect. 3, your go-to bedside tests are line cancellation, clock drawing, and checking for extinction. And 4, always be able to tell it apart from hemianopia, which is vision loss, and hemiparesis, which is motor weakness. Okay, quick case. Picture this. A patient's left arm is just hanging limp, dragging on the ground. But when you test her strength, she's a perfect 5 out of 5. She can lift that arm without any problem when you ask her to. So this isn't weakness. What is it? That's a classic case of motor neglect, a failure to use the limb because of a failure of attention and intention. Here's another one you might see. A guy comes in, and the right side of his face is perfectly shaved, but the left side is completely stubbled. What does that scream to you? That's personal neglect. It's a subtype where the patient's own body is the target of the neglect. That side of his body has just been erased from his mental body map. Here's a quick clinical pearl for you. Why do we have to be so picky about how the patient and the paper are positioned during testing? Well, it's because a patient can actually cheat unconsciously. If they're allowed to turn their head or body to the left, they can shift their whole frame of reference over and bring that neglected space into their attended space. That can give you a false negative. So you have to make sure everything is lined up right at the midline to get a true result. And we'll end on this final thought. Neglect syndrome is so much more than just a clinical curiosity. It's a profound lesson in how the brain works. It shows us that our seamless, stable perception of the world isn't just a passive recording of what's out there. It's an active and, frankly, fragile construction of our brain. And if one little lesion can just delete half of reality for someone, it really forces us to stop and think about the nature of our own conscious experience.